If you have ever worked on your core unsuccessfully, if you started working on your core and your back or neck started hurting, then watch this video till the end because there are some useful tips coming your way. Hi, I'm Dr. Rajani Patil from Ortho Sports Physiotherapy. I'm a spine and sports physiotherapy specialist practicing for over 23 years. My clinic is in Shivaji Park, Mumbai. अगर आपने आपके कोर पे वर्क करने की कोशिश की है, then most of you have been doing crunches. This brings me to the biggest myth of all. Everybody thinks that core is abs. Okay, let me break that now. अगर मैं आपको बोलती हूँ कि आप आपका कोर टाइट करिए, आप क्या करेंगे? हाथ पेट पे रखेंगे और तभी मसल्स अंदर पुल करेंगे, करेक्ट? लेट मी टेल यू, abdominal muscles are just one fraction of the core. Your core is made up of a lot more muscles. What exactly is the core? Your core is the midsection of the body, your trunk, lower back, abs, hip muscles. All these make your core. People think that working on your abdominal muscles is it. Core का काम हो चुका. Just doing planks, only doing crunches or some side planks, this is not enough to work on your core. Your core is a unit which is made up of 29 pairs of muscles. Only if all these muscles work together, only then is your core really strong. If you work only on your abdominal muscles or only do planks, you are only strengthening a part of your core and this can actually do you more harm than good. क्यों आपको कोर पे काम करना चाहिए? किसने इस पे काम करना चाहिए? अगर आपको कभी भी बैक पेन का इश्यू हो चुका है, तो अगर आपका कोर स्ट्रांग नहीं है, प्लीज इसको सही तरीके से आज ही ठीक करिए. अगर आपको पोस्चर पे काम करना है, आपको कॉन्फिडेंट दिखना है, अगर आपको पेन नहीं चाहिए, इंजरीज नहीं चाहिए, ऑल दिस ब्रिंग्स बैक द कोर. अगर आपका कोर स्ट्रांग है तो पेन जल्दी नहीं आता है, आपको मसल स्पैज़म्स नहीं आते हैं, आपका पोस्चर अच्छा रहता है, आप रन, वॉक, साइकिल, कुछ भी जो भी आप करना चाहते हैं ये ठीक से हो जाएगा विदाउट एनी प्रॉब्लम. सो इन ऑर्डर टू वर्क on your core successfully without having any back or neck pain, you're going to follow the next few steps that I tell you. First and foremost, stop doing only crunches. I'm not saying stop doing any crunches, I'm saying stop doing only crunches. There are so many other good exercises you can do for your abdominal muscles. But remember, abdominal muscles are only one part of it. So make sure you're working on all the muscles of the core, especially your glutes, your lower back. Use your breathing, so you're using your diaphragm, your pelvic floor muscles. All these need to be engaged when you're doing core exercises. Point number 2, make sure you're understanding what your core strength is right now. For you to understand that on your own, there are some tests that you can do. There is a video that I have done, DIY assessments for your core. You can check that out. I'll put the link. But meeting a sports physio, meeting a physiotherapist who understands the spine really well, get an assessment done to understand how strong your lower back muscles, your abdominals, your glutes, all the muscles of the core, whether they are actually strong and whether what the work that you're doing towards your core, is that actually helping or it's not helping. Point number 3, stop doing the core exercises that are making your back worse than better. These exercises are not doing you any good. Please do not do them. The first one is a crunch. I've explained that to you. The second is a deadlift. The third is lifting both the legs up. If you have ever had a history of back pain, these are the exercises that you need to avoid. Trust me, there are so many better exercises to work on the core. If you're interested in learning what these are, then get in touch with me. Just watch the video that I have made before on the worst exercises for the back. I'll put a link below. And if you need my help to understand, learn how to scientifically work on the core, then join the Bulletproof Back and Core program. This is basically a 10 sessions program where I teach you individually how to work all these different muscles of the core and then put it together and make it nice and wholesome for you. Point number 4, you want to make sure that you activate your muscles before you strengthen them. Like I tell my patients, learn to walk before you run. Everything needs to be sequential. सब कुछ फर्स्ट स्टेप होने के बाद ही फिफ्थ स्टेप आता है. बट मोस्ट ऑफ द पीपल दैट आई सी हु कम इन विद बैक एंड नेक पेन, मोस्ट ऑफ द टाइम व्हाट दे हैव डन इज उन्होंने सबसे हार्डेस्ट कोर एक्सरसाइज कर ली बिफोर दे इवन वर्कड ऑन द फाउंडेशन. व्हाट इज द फाउंडेशन? आपको आपका कोर एक्टिवेट करना है, एब्डोमिनल मसल्स एक्टिवेट करने हैं, ग्लूट मसल्स एक्टिवेट करने हैं. अगर आपको नहीं पता एक्टिवेशन का मतलब, बेसिकली यू वांट टू कॉन्ट्रैक्ट दीज मसल्स एट विल. आपको मसल्स को कॉन्ट्रैक्ट करने को आना चाहिए स्ट्रांगली, अपने आप, वॉलंटेरिली। अगर ये नहीं हो रहा है तो दैट्स अ प्रॉब्लम। दैट मीन्स अगर जब आप चल रहे हैं तो अपने आप एक्टिवेट नहीं हो रहे हैं मसल्स, और इसकी वजह से हिप जॉइंट, नी जॉइंट, लोअर बैक, इस पे बहुत स्ट्रेन पड़ता है, लोड वहाँ ट्रांसफर होता है। फॉर दैट, activate your muscles before you do any of the advanced stuff. I have made a video on muscle activation, so वो आप check out करिए, I'll put it in the link below. Point number 5, लोगों को लगता है कि core strong होने के लिए सिर्फ strengthening exercises करनी चाहिए। ये बिल्कुल गलत है। अगर आपको चाहिए कि core muscles strong हो, you have to work on mobility. For example, अगर आपका हिप जॉइंट, हिप फ्लेक्सर्स, फ्रंट वाले मसल्स, अगर ये ओपन नहीं है, आपका हिप जॉइंट ओपन नहीं है, तो आप कितना भी ग्लूट्स को स्ट्रॉन्ग करो, वो स्ट्रॉन्ग नहीं होने वाले हैं। अनदर एग्जांपल, आपका लोअर बैक अगर स्टिफ है, थोरैकोलंबार फैशा बोलते हैं इसको, इफ दिस इज टाइट, देन अगेन आप कितना भी एब्डोमिनल मसल्स को ट्रेन करेंगे, वो स्ट्रॉन्ग जल्दी नहीं होंगे। Your core exercises will remain ineffective, or they will be 20-30% effective. But what do you want? You want 100% effectiveness for every single core exercise that you're doing. So work on your mobility, especially of the joints that matter to the core. Work on your breathing, because your diaphragm is your primary breathing muscle, but it's also a core muscle. Don't forget that. So आप जब core exercises करते हैं, आपकी breathing ठीक से हो रही है कि नहीं, ये ध्यान में रखिए। Most people when they are doing core exercises, they are holding their breath. इसके वजह से hernia होते हैं, neck pain होता है, back pain. तो I've seen so many cases coming in from doing a core exercise wrong. So don't let that be you.
So now that you know the basics of core, please start working on your core in the right way. Do not stop doing it the wrong way. If you need my help with this, please let me know. Put it in the comments below. If you had back pain because of core, if there was an exercise that worked for you, that did not work for you, let me know in the comments and I will get that. The Bulletproof Back and Core program, this I teach individually, which can be done online as well as offline. So if you want to come down to the clinic and learn with me, it's a 10-session program. And like I said, I work on individual muscles of the core. Or if you want to do it online, wherever you are, then it's absolutely possible. I will give you all the resources and you can start working on your core in a very wholesome and scientific manner. If you are interested in BBC, Bulletproof Back and Core, then I'm putting a link below. Sign up there, just put your details in and your question about the core, and I will get back to you and tell you the next few steps of how to do it. If you think that this video has been helpful to you, share it with your family members, share it with your workout group, share it with friends who you think are doing the core wrong, or people who have back pain and they need to be doing the right exercises and stop doing the wrong exercises. Send it to them as well. And don't forget to like, share and subscribe to this channel.